think it's very important to manage patients' expectations. To quote Joe Yuritsa, who's my mentor from residency, what you tell patients at the first visit is patient education. What you tell them at follow-up is an excuse. So you really have to let them know what to expect during the aspect of their visit and during the aspect of their treatment. So let's, for example, take a patient with acne. Somebody comes in with acne, they have some comedones, maybe a few pustules, some persistent erythema, and some post-inflammatory hyperpigmentation. Giving them 2 prescriptions for whatever your acne du jour treatment is and running out of the room is not going to be good enough, because even if their acne gets better, they're still going to have red spots and they still may have dark spots. So when they come back in 2 months, a month, 2 weeks, whatever it is your follow-up is, they're going to not think that they got better. So it's really important from the beginning to let them know what the course of treatment is. So what I tell patients is that their acne may get worse before it gets better, but what we're really focusing on is treating all the bumps, so the comedones, the inflammatory pustules, but all those other marks, what I call quote-unquote scars from acne, they may not go away with the treatment that we're prescribing. So later on, once their acne gets better, we may be able to do something to improve their overall cosmetic appearance with things like peels, lasers, etc., etc. But if you don't tell patients that at the beginning, they're going to not think that your treatment is working. And I think that's also very important for having compliant patients, because if they're using a product for, let's say, a month, and they see that some things are improving but some are not, they may say, oh, you know, this is just not working, I'm going to go see somebody else. But if you tell them from the beginning what to expect, I think they're more likely to use their prescription and then come back for follow-up so that you can address those other issues that haven't gone away completely. Let's take a cosmetic patient. It's very important to have those, to explain what the expectations are. And you also have to ask the patient, what is it that they're looking for? Do they want their forehead to have no mobility whatsoever? Do they want just a little bit of a raise of their eyebrows? Do they want, do they have a party the same week and they expect to be perfect in a week? These are all important questions so that you can address to them, for example, that with botulinum toxin, it may take 2 weeks for you to have the maximum correction. I think augmenting lips is one of the most important cosmetic procedures where it's important to set realistic expectations, because most patients get swelling right after the procedure, so you have to tell them that you're going to be swollen for a few days, but your lips are not going to be as big as they are when we finish the procedure. So when the swelling does improve, they're likely going to be a little bit smaller than what you're actually walking out with, so that you don't get a call the next day saying, oh my God, I have duck lips, this is terrible, I want you to come in and melt the hyaluronic acid that you just injected me with. So again, it's very important that you set the patient expectations correctly. The thing that I do routinely, and I think that helps with managing cosmetic patients, is I always call them a few days after the procedure just to make sure that they're happy with the results. And I always encourage them to come back in 2 weeks so that if there is an issue, we can fix it for them, as opposed to them just wondering why it turned out the way that it did. Everyone wants to have a practice full of happy patients. I joke with my patients that happy patients make a happy doctor, because if your patients are not happy, guess what? You're not going to be happy either. So managing the expectations of your patients is very important. So it's important that you set the tone correctly at the first visit or in the beginning of doing a new procedure or treatment. So tell them what to expect, what the course of treatment is going to be like, and make sure when they return, you review those expectations. So let's say you're treating somebody with chronic plaque psoriasis and you're just giving them topical agents. Let's say you've given them some steroids and vitamin D. They come back in a few weeks and they still have some redness and maybe still a little bit of thickness of their plaques. Well, I always say, well, remember when we met originally and we talked about this condition, we talked about the fact that scaling is going to get better first, then the thickness may go away and decrease, and then the redness is the last thing to go away. And I think if you're honest with your patients and you've actually done it, they're going to remember it, say, you know what, I do remember that, so we're going to continue with our treatment until we get better. And then they can also say, well, you know what, this is just not working for me, so let's move on to the next step, which may be phototherapy, oral agents, biologics, etc. So in this way, the patients have the right expectation, and when they return, they're going to know that we've talked about the things that they should be expecting, and what we've said is basically an honest answer to their question. And I think that actually gives you a lot of leeway into having those patients go back to their primary care doctors, to referring doctors, and say, you know, I saw this doctor so-and-so and had a really good experience, even though things are not perfect. I got exactly what I expected because we've talked about it. And I think the best referral source for practices, at least in my mind, is not just the web, but it's really patients and their family, their friends, et cetera, et cetera. So if you do a good job and if you're honest with your patients and if you set the expectations correctly, you should have a very busy practice because your patients who are going to love and adore you for trying to help them are going to be sending you other people that they know. Now, you can do all these things right and still have unhappy patients because there's some patients that are just unreasonable, or what I like to tell patients is our personalities are just not in sync. So maybe we're just not the right people to work together. So let's say we've done all the things, we've talked to the patients about their condition, explained it to them, set the right expectations, they come back and they still expect to be perfect. And there's some patients that you just get sort of the feeling that you're just not going to mesh well together. So what I tell patients at this point is that, listen, I'm sorry, I don't think I'm the right doctor for you. I'm happy to go through with you a list of other excellent dermatologists that maybe have different personalities, different approach to treating your condition than I do, and I'm happy to send them a letter explaining everything about your condition, everything that we've done together so that you can have an easy transition from my practice to somebody that may be able to help you better. And I think with setting that kind of a tone with patients, I think most patients understand, and they may actually have the same feeling that we're just not right for each other to work together to help with their condition. And this way they can sort of transition to somebody that may be able to help them in a better way that you can. In conclusion, I think it's very important to be able to manage patients' expectations. So set the expectations right from the first visit or the first time you're seeing them for their condition, and sort of review those expectations with them every time you see the patients. And I believe with that strategy, you would have happy patients that are compliant, that understand what their condition is all about, and will work with you in order to improve.